My name's Bhavini. I'm from East London and I have retinitis pigmentosa. The last eye hospital appointment I had at Moorfields, I was at reception. I was faced with a self-check-in system, which I couldn't see the screen or access in any way. A member of staff or volunteer came up to me and insisted that I need to use it to help check in because that's a new system and it will save queues. I kindly explained that I can't see that or press any of the buttons on it because I don't know what I'm doing. And then I don't think he was really happy with it. I then went to my LVA appointment and I was given at the time I'm not sure what it was, but it was a feedback form. I asked for an accessible version of it or if someone can give me assistance to complete the form. But at that time, no one was available or readily available for me to get that help. So unfortunately, I could not complete that form. I also have, so normally when I come to visit Moorfields, I have a couple of appointments on the same day. So I went to my clinic appointment and usually they put drops in my eyes, which dilates my pupils. So my vision's even more blurrier. And usually they take photos at the back of my eyes. Eventually, when I was called, the lady sort of called my name and she walked off. So I had no idea where she went. So I asked my guide dog to kind of see or if she, if he could follow the lady, if he knew who it was. And I sort of said, where is, I don't know where you are. And then she just came and sort of grabbed my guide dog's lead, which is not something you're supposed to do. When sort of coming into that clinic, I said I'm here for my appointment, and at that time my husband was there. And instead of speaking to me and telling me, what's your name, what's your date of birth, just to check me in, she started speaking to my husband, which I thought that was a little bit rude. What's her name, what's her date of birth, and I was standing right there. There were several other experiences, but I felt as an eye hospital working with blind and partially sighted people, it was quite disappointing. So on the day when it actually happened, afterwards I knew someone at Friends of Moorfields, and I sort of sat with her and I didn't tell her what had happened because I think at the end of it, after all those experiences, all in one day, I felt like crying. I just wanted to break down because my sight is at its worst now, and I didn't want to hear that, oh, it's dropped again, because I want to cling on to the little bit I do have. Year on, they tell you that, oh, your sight's, your field of vision's gone a little bit more down, or your the little cataracts that you have, it's ripened up a little bit more. And all the experiences that I had, that I was close to tears. So it was really nice sitting with her and sort of just forgetting about it and just hearing what she's been doing, supporting other blind and partially sighted members in the hospital. So when the blog was picked up and I was asked to come and share those experiences and they were actually willing to listen,